Hi, Doc.
How are you?
I'm good, thank you. How are you?
Good. You have a beautiful smile. Oh my
Oh,
gosh.
thank you. Likewise, likewise.
It's nice to finally meet you.
You too.
I
So
know
glad
we've
to
been chatting
put a
back
face
and
to
forth.
name.
Sorry, say it again.
Oh, I just said it's so great to finally put a face to a name.
Absolutely, yeah. We've been like chatting back and forth, but it's good to finally speak.
Likewise, likewise.
Help me say your last name. I don't want to say it wrong.
It's Pospos
Pospos. Okay.
and yours?
I've heard people pronounce it differently, so I wanted to be safe and just have you saying it instead of me.
And yours too, please. I don't want to butcher it in front
Oh
of the
yeah.
internet.
Yes, Duro Wade.
Dr. Durawade. Got it. Did I say
Yes.
it right?
Yes, you did. You got it on the first try.
Ooh.
All right. Thank you so, so much for accepting my invitation. Also, I think you're in a wonderful field. I mean, we find that we don't know who to send our patients to when they come to the office and are asking for help. We do our best to counsel them, to reassure them, but sending them to someone who specializes in it, I don't know that that's readily available. How did you get into this specific, field of psychiatry?
Yeah, absolutely. And thank you so much, Dr. Durwadi. It's such an
Yeah.
honor to be here today. I really appreciate it. So I do have to confess, I have a little bit of personal stake in terms of getting into perinatal psychiatry. Uh,
Hmm.
but first of all, to answer your questions, why I became a psychiatrist, I've always, I strongly believe that as humans, we all have our highs and lows. And I think it's such a privilege to be able to help people, especially during the lowest of their lows.
Hmm.
And I think we could definitely get that in psychiatry. In terms of perinatal psychiatry, I got pregnant and gave birth to my first baby during residency in the middle of psychiatric residency, which just happened to be early on in the pandemic. So, as you can probably imagine, it's just my husband and I for the first 6 months. We don't have any family nearby. They couldn't travel to be with us. No childcare. Everything is up in the air, and of course, we're clueless about what to do with the baby, right? Since it's our first one. So during that period, it just hits me that wow, this could be such a difficult time, and it's very easy to feel alone and feel helpless even during this period, and that's what got me into perinatal psychiatry.
Oh, wow. Wow. How did you get through that period of time? What resources did you tap into to get through that?
Great question. I think for the most part, just not having any other choice
Mm,
kind of pushed me through. But
mm,
then I lean more into saying yes for support, for extra support whenever available. So,
mm,
for instance, we started outsourcing. We started to look into finding a good nanny, which helps a ton. We started to reach out to family members and other veteran moms to, get the how to's and whatnot if we have any questions, concerns. Of course, a lot of resources are also available in the internet and social media, which help, but also the other side of things can, easily makes us feel a little bit overwhelmed and confused when there's too much info out there.
mm,
But I think just the mindset of accepting help and giving ourselves permission to not do everything perfectly helps me a ton
mm.
at that time.
Well, that's a wonderful point. Giving yourself permission not to do everything perfectly. As a first-time mom, you don't want to make any mistakes. You don't want to drop the baby. You don't want to feed the baby the wrong thing. So, giving yourself permission to make mistakes, that's a mindset change. Would you say that it took you a second to reach that mindset change that allowed you to then get through that period where it was just you and your husband?
100%, 100%. Like you said, it's a mindset change, and it's very difficult to get there, right? Which is often the case with any mindset adjustment, I think. But yes, after I get to that point, I think, or personally, I feel a significant difference in myself, and it helps very much.
Wonderful. So I'm going to do a brief intro so that I can officially introduce you. Dr. Sarah Pospos. I said that right?
Yes, perfect.
She completed her psychiatry residency as a chief resident at UCLA Kern and has published extensively on burnout and depression at UCLA, UCSD, and UCSB. That's San Diego and what's the SB?
Santa Barbara.
Santa Barbara, okay. As a perinatal psychiatrist and a mom of two under two. Two under two. And a doctor. She is devoted to helping moms and moms-to-be with burnout, depression, anxiety, and other psychiatric challenges related to preconception planning, IVF, pregnancy, postpartum, breastfeeding, and others. Dr. Pospos also empowers moms who often juggle multiple responsibilities to optimize and balance their lives by incorporating exercise, nutrition, sleep, stress management, efficient time management, who doesn't need that? We all do, and other sustainable lifestyle changes in her telepsychiatry practice. That is an impressive bio. Tell me a little bit about your telepsychiatry practice. When did you begin? How do you serve people, and where can people reach you?
Yes, absolutely. So currently, my practice is fully telepsychiatry, 100% virtual, and we're serving patients all across California. And currently, I'm non-insurance based, which for you, the listeners out there, means a couple of things. One, we're not limited in terms of your insurance coverage or insurance. Limited insurance situations, perhaps. And two, I'm able to give you a more personalized care in that way without, considering all the limitations that at times might be juxtaposed by the insurance.
Wonderful. Are you able to see people outside of California? I mean, since you're cash-based and virtual, you'll be able to see people all over the country. Is that correct?
So for me, unfortunately, no at this time, just because my medical license.
Yeah.
Right.
Okay.
It's California based.
Okay.
Right now.
Okay, just for now, but plans to expand.
Right. It's in the
Just
books.
because I think it's a great service. I mean, like I said at the beginning, I don't know that we have psychiatrists dedicated just to moms. Or that period of time where you just had a baby and you're just trying to figure out what to do or how to manage everything. And just helping people get to that mindset shift of you don't have to be perfect. You just have to be, you just have to do what you can, and being the best version of you while you're caring for that baby, that's what they really need instead of perfection. But it takes a minute for people to get there. So having that coach, that psychiatrist, that doctor, to walk you through it, I think is really a vital service. So I look forward to you expanding.
Thank you so much.
I wanted to ask you, what are some uncommon knowledge things about perinatal health for new moms, or just moms who have two under two, babies and trying to juggle life? What are some uncommon knowledge tidbits you want to share with them, and then maybe we can answer some of the questions that we got from our followers online. So I'll give the floor to you to just kind of give us just a little here and there what people should know that they don't know that can help them, and then we can address some questions.
Yes, that's such an important question, a very loaded question, right?
Yeah.
I think one thing that comes to mind, perhaps in psychiatry, as child psychiatry, we have this concept of good enough parent, good enough mom, which I believe just even underlines the importance of accepting that perfection is an illusion, right? Which could be very, very hard as a mom, as a parent, because not only that we're dealing with ourselves, but of course, as moms, we love our kids, and the stake is higher, so to speak, in that regards. But it's very helpful to always remember this concept of good enough parent, good enough mom. Um, I think first and foremost, that would be the uncommon knowledge that I would love to share, just to get the words out there. So all the moms out there, especially when dealing with mom guilt, when dealing with unattainable, unrealistic expectation that society puts on us, as well as the ones that we put on ourselves, um, to be able to help them a little bit in that regards.
Oh, wow, I think that's loaded. That's loaded. Good enough mom, meaning that you do what you can, right? Some expectations, people put out there, being a strong woman is working a full-time job and being able to take care of your home, being present for all your kids' activities, and yeah, that's a lot of pressure for someone who maybe is just you and your husband, and maybe you have one nanny. That's a lot of expectations on the mom. And so figuring out what you can do and doing what you can, I think, would you say is the point that you're trying to pass across?
100%, 100%. And also, I think just to add to that note, in parenting as well as in life, I think life in general, I strongly believe that some is always better than none. So
Mm,
perhaps when we set our goal is up here, we don't have to always hit it 100% from Monday all the way through Sunday, right?
mm,
But in reality, at times, it's very easy for us, myself included. If we are here, one day, we consider everything, just as a failure. But in
mm,
fact, in a lot of things, if not most things in life, some is always better than none.
mm,
And it's very important I think, to incorporate that concept, including for self-care as well for us moms.
mm. So you don't have to, and someone like me who's a doer, I always set goals for the day. I want to do this, I want to do this, I want to do this. And there is that guilt when you're not able to achieve it. You feel like you've wasted the whole day. But that change of some is better than none. Okay, I didn't get 10 done, but I got 5 done. And giving yourself room to be grateful for that, right? Um, so that's that. Some is better than none, good enough, mom, right?
Yep, totally.
What do you find that you deal with a lot with moms? What is the biggest issue that moms seek you out for?
Yeah. So I think some of the most common questions that I got include, one is this normal, meaning
Mm,
is this sort of feelings normal? Is this sort of
mm,
symptoms normal? The list goes on.
mm,
Two, on that regard, does other mom feel or
mm,
experience the same way?
mm,
Because as all the moms out there know, it's very easy for us moms to get overwhelmed, right? And being a parent itself is a huge, huge life transition, which means there's a lot of changes in
mm,
our life. So it's very understandable to question, to wonder if this is normal, if this is not normal, if other people are experiencing the same thing, and what to do about it.
mm, mm.
And then,
So, yeah, go ahead. Go ahead.
sorry, go ahead.
No, go ahead.
Um, to add to that too, I just want the listeners to know that a lot of the big feelings, the huge mixed emotions, and perhaps symptoms that you may experience as a mom could be very, very common. So just to throw the statistics out there, baby blues or postpartum blues.
Mm,
Which is experiencing a lot of huge emotions, mixed feelings, perhaps being very tearful, very sad, missing our old life, and a lot of other emotions in the first few days after birth is very common, and in fact happens to 80% of moms. So
oh,
that
wow.
means if there are five of us in the room, four out of five may experience that. And on top of that, postpartum mood and anxiety disorders. So, perhaps feeling depressed, feeling anxious after postpartum is also very common, and it happened to 20% of us. So, one out of five moms may experience it. So, if the listeners out there, if you're experiencing any of the symptoms, please know that you're not alone. And despite doing everything right, everything by the book, this is still very, very common and could happen to a lot of us.
Thank you for addressing that. That's one of a couple of the questions that we have on our list, the postpartum anxiety and postpartum depression. Now, we consider the perinatal period to be the pregnancy period and up to 6 weeks after. Would that be the same definition that you have as well?
Yes, so for perinatal, there are a lot of definitions out there, including in different research studies. But I think, like you mentioned, one of the more common ones is the whole pregnancy plus 4 weeks, perhaps. But of course, postpartum symptoms could happen even well after that 4 weeks postpartum. Right.
Right. Absolutely. Absolutely. So one of the questions I got was about postpartum anxiety and how that's different from postpartum depression. Because, the official diagnosis of postpartum depression is that it is persisting even, after 2 weeks. After 2 weeks of, adjusting to the baby, getting home with the baby, you're still feeling those depressive symptoms and you're moving from postpartum blues to postpartum depression. And so if you could touch on how postpartum anxiety is different from postpartum depression, how long it lasts, and what people can do about it.
Yeah, absolutely. So perhaps the one way to describe it is to differentiate between depression and anxiety, right, in the first place. So the depression and anxiety can present with a lot of symptoms, but some common ones are as follows. For depressions, perhaps you're experiencing feeling sad, feeling down, some crying spells for most days of the week. Perhaps you're not enjoying things that you used to like in the past, your hobbies. Perhaps the symptoms cause some difficulties and for you in focusing, concentrating, sleeping, eating. You may experience negative thoughts such as feeling hopeless, helpless, useless, excessively guilty, all the way to having suicidal ideation. On the other hand, for anxiety, typically some of the more common symptoms include feeling internally restless, always feeling on edge, keyed up. Perhaps you're experiencing some muscle tension that could also impair your focus, concentration, sleep, as well. Panic attack, it's not uncommon. So for panic attacks, it could be a sudden urge or sensation of anxiety that is accompanied by heart racing, difficulty breathing, chest tightness, tremors, perhaps, feeling dizzy, and other physical symptoms associated with this state of anxiety. So symptoms-wise, that would be the main difference, I would say, between depression and anxiety, including postpartum depression and postpartum anxiety. But it's always important to know that depression and anxiety outside and within the context of postpartum are very often overlapping with one another. And then in terms of what to do, there are two key red flags. So if you think or you notice in your loved ones that the symptoms, one, are causing severe intense distress in yourself, or two, they're interfering in any way with your day-to-day. So that could be impairing your relationship, your work, your grades if you're a student, the list goes on, then it's time to seek out professional help.
Okay, so the symptoms of depression and anxiety can mix. It sounds like anxiety has more physical effects, like muscle tension, like you mentioned, tremors and things like that. And depression may be just a little bit more feeling down and feeling sad versus more physical symptoms that anxiety can create. And those things can happen while you're pregnant and even after you're pregnant. But when they begin to affect your relationships, when they begin to affect you being able to do your work, then that's when to seek professional help. Is that correct?
Yeah, definitely.
Or when you start having any suicidal thoughts, then that's when to seek professional help for sure.
100%.
Yeah. Something you mentioned earlier on, you said sometimes new moms can miss their old lives. Can you touch a little bit on that for me? I want to expand a little bit on it and how they can maybe overcome that. If you have any tips that they can maybe overcome that.
Yeah, definitely. Parenthood is a huge life transition, right? Being a mom. And from then on, life is never the same again.
Mm.
Um, I think the first step perhaps is to give yourself permission to accept that.
Mm.
And
That
then,
it's okay to feel that way, right? And not be
it was,
guilty. That
yes,
it's
yes,
okay to feel like you miss your old life and not be, feeling guilty that you have this great gift of a baby. Why would you miss your old life? Because I feel that that's something that would make people feel like they're not a good person. Like there are people looking for babies and I have a baby and I'm feeling like, so giving yourself permission to feel these things and not feel guilty about them. Am I correct?
definitely, definitely. Thank you for putting it so eloquently, Dr. Durrati. That's the key, I think. First and foremost, is to give yourself permission to feel that, like you said.
Mhm.
And then the second thing, which I think could be very helpful, is incorporating self-care. And of
Mhm.
course, a lot of you may think, myself included in the past, it's easier said than done because especially with the new baby, right? Newborns, it's so hard to find time to sleep. How in the world can I even find time for self-care?
Mhm.
So my tips for that, I have two. One is effective stress management, and two is sustainable lifestyle hack. So
Mhm.
in terms of managing our stress, I just like to review that stress doesn't only affect our mind. In fact, stress has a downstream effect that affect all of our mind and body, right? So for instance, stress induce our fight or flight or freeze response, which in turn, just as an example, could increase our heart rate, our respiration, give us some muscle tension perhaps, and in our brain switch our focus between the amygdala, our fear related brain, um,
Mhm.
and allow it to take
Mhm.
over our prefrontal cortex, which is the part of our brain that allows clearer thinking, just to name a
Mhm.
few. So
Mhm.
having said that, perhaps an effective stress management would be one that target most of those things. One of my favorite is one portable techniques that we can literally do everywhere. So when chasing our toddlers, when breastfeeding, when picking up and dropping off our kids in the traffic, perhaps, and that is deep intentional breathing, which use your diaphragm or your belly. So I'd like to count to six while inhaling, count to six while pausing, count to six while exhaling, and repeat it a couple of times. And what it does, it switches our focus from that sympathetic, that fight or flight system, to the opposite of parasympathetic system, which has the opposite effects of the reactions that we talked about earlier.
Mhm.
And then my second recommendation, the lifestyle hack one, is to exercise.
Mhm.
And as a busy mom, busy new mom, it's very, very hard for me to find time for one dedicated hour at the gym, for example. So what I did is try to squeeze in or try to reframe exercise, first of all. Not exercise per se, but try to think of it as being physically active, as physical movement, right? As of right now, one current CDC recommendations is aerobic exercise, which literally just means anything that raises up your heart rate. And
Mhm.
by anything, I literally mean any type of movement. It
Mhm.
could be chores, it could be moving things around the house, perhaps decluttering, it could be squatting while you're brushing your teeth, literally anything that could raise up your heart rate. And to what
Okay.
point? To moderate intensity, which just could mean that you can perhaps still talk within the exercise session, but not flawlessly sing. And for
Mhm.
how long? At least 150 minutes per week, which if you break it down, perhaps it could be half an hour on work days, Monday through Friday. And for me, I try to squeeze this in, for example, by putting the kids in the stroller and taking a walk, taking a stroll outside with my husband and our dog after a long work day, and by brisk walking, by taking the pace, a little bit higher, I could hit my exercise goals as well as getting some quality time with the family and getting things done that way.
Well, that's wonderful. So one of the best ways to handle the new life, the new pressure of parenting is stress management and a life hack. So stress management would be your stress level makes you more anxious, makes you, like you said, puts your brain in the flight or flight area instead of the logical, calm thinking area. And so one way to switch from that is to do something like the breathing exercise you mentioned. I'm actually trying to see if I can practice breathing in for count into six, and then you pause for six, and then you breathe out for six. That's
Yep.
intentional breathing. I don't know if I can do it. I'm literally counting 1, 2, 3, 4, 5, 6. 1, 2, 3. It's very intentional, but those are things, like you said, they're grounding exercises. They can remove your focus from what is causing you that anxiety and sort of help you maybe see it in a different perspective. But it allows you to pause, assess what you're feeling, and maybe deal with what you're feeling. Reframe it like, okay, I feel anxious right now because I'm late to picking up my kids. Okay, what can I do to reduce my stress? Maybe I can have someone watch them. I can notify someone that I'm running late. Just helps you get back into your logical thinking, and instead of you panicking because you're running late to pick them up, something like that.
Yeah.
And then, so that would be like, the way you can get out of that is practicing some sort of grounding exercise, breathing in and out for a second, giving yourself a minute to assess what the emotion you're feeling is. Is that pretty correct?
Yep.
Okay.
Definitely.
And then I like your second one about a life hack, so it doesn't, part of what makes it difficult for me, even I'm not a mom yet, to exercise is that I have to go to the gym for like 1 hour. Like that idea that I have to be in a place and do something there. And so I'm like, oh, I have to drive. Oh, it's too dark. It's too dark already. It's winter. It's getting dark at 5 p.m. now. I don't want to go, but changing it up so that it's not exercise. I can do it anywhere, anytime. I can squat while I'm brushing. I can squat up and down. I'm going to try that actually. But anything that gets your heart racing, gets your body moving. It could be dancing. You could be playing music as you're trying to get the kids ready. Something that gets your heart racing. You don't have to be able to talk flawlessly through it, but then you can maybe still say a few sentences while you're doing it. So it's not intense exercise where you can't even talk, but something that gets your blood flow moving, will also reduce your stress level. So that's one of those two will be self-care things you can do to address, the change of life that happens when you become a parent. Would you say that summarizes?
Yes,
Okay.
definitely.
Wonderful. Thank you for sharing that. Those are really simple things that people don't think about, or people don't know. People think I just have to do everything. But I appreciate that, giving yourself room to be good enough, not perfect, doing what you can and being okay with it, not feeling guilty about it. And if you have some guilty feelings, you can do this stress relief and life hacks to kind of help you overcome it. But if it's getting worse, none of these things are working, then it's time to seek help. Ask someone for help. And it's okay to ask people for help when you become a new mom. You don't, this is a new terrain. Even if you've had a kid before, every child is different, right? You have to adjust to the needs of the second baby. So I think that the biggest point I'm getting from this is you're doing fine. It's okay, right? You're doing fine. It's okay.
It's
Awesome.
okay.
Awesome. So there's a question here. And I think you addressed it already. You said what to expect at 1 week postpartum. And I would imagine it's the same things we've talked about, mixed feelings, missing your old life, feeling like you're not doing things right, feeling like overwhelmed, tearful, sad. Um, but those things we've already talked about, sort of how to address them. Um, Someone said, can pregnancy cause PTSD? I
Hmm.
think the answer would be yes, but I'd like to address it.
Yeah, that's a great question. So, in theory, the definition of PTSD, right? It has to include some sort of trauma. The
Mhm.
trauma could be a lot of things. For example, anything related to death or serious
Mhm.
injury, and that could be, giving birth, as we know, could be traumatic in that
Traumatic.
sense.
Yes.
Serious complications may definitely
Yeah.
occur. Um,
Yeah. Yeah.
so, in that regards, it could be. And for PTSD, some of the symptoms to watch out for is if after your delivery down the line, perhaps you may experience some of the more common symptoms, which include daytime flashbacks or recurrent nightmares about what happened, about the trauma. Perhaps you may experience, getting more easily startled, always on
Mhm.
hyper alert all of the time. Perhaps you might experience low mood, difficulty to concentrate, difficulty sleeping, and things of the likes. With relation to this trauma, this delivery, traumatic delivery,
Mhm.
then perhaps it's also a good time to reach out for professional help.
Mhm. So, the big one of the biggest symptoms are the flashbacks and being easily like startled, uh, um, and that's something that you should not handle yourself. That's something you should seek help for.
Right, especially if those two red flags that we talked earlier are
Mm.
happening as well.
Right. So interfering with your day-to-day activities. And what was the second red flag?
Causing severe, intense distress in
Okay.
yourself.
Okay. Okay. Thank you for that, for the reminder.
Right.
Okay. Um, what is the most critical time of the postpartum period? I would imagine that that's with respect to, because the most critical time for the postpartum period for an OBGYN is different. How I would answer that is different from how you would answer that, for mood symptoms. So what, mood wise or stress wise or emotion wise would be the most critical time in the postpartum period, would you say?
Yeah, so traditionally, in terms of a textbook definition, for baby blues, it's the first few days, typically lasting up to 2 weeks.
Mm,
And then postpartum depression is diagnosed when these feelings or symptoms persisted after that.
mm,
Although, again, it's different for everyone, it could happen at any point in time of postpartum. Um, Different studies have different parameter in terms of when they define this postpartum, quote unquote, postpartum depression in this case, period. But there's one study that mentioned earlier postpartum period could be associated with a more severe symptoms than the later one. So
mm.
I believe the cutoff for that study is within 8 weeks. If the symptoms present during that time, it could be more severe than the symptoms presenting later on down the road.
So you're saying symptoms of depression that show up within 8 weeks of being postpartum
Mm-hmm.
can be more severe than symptoms that show up after 8 weeks postpartum?
Correct. But again, it's just one of the studies, and
Oh,
there is
okay.
still a lot
Okay.
of variation
Okay.
within this regards out there.
One of the things that I find that I counsel my patients about is not to be afraid to take medication. Um, So a lot of people are like, is this going to affect my baby? Because sometimes they're feeling these symptoms while they're pregnant. They're feeling anxiety about the birth. They're feeling anxiety about when the baby will come home. Or they're feeling their depression. Maybe they had a little bit of depression before pregnancy and now it's like magnified now that they're pregnant. I always tell my patients to not be afraid to treat it then because it's only going to get worse even after the baby comes, because there's more stress, more lack of sleep, more responsibility after the baby comes. So if it's not taken care of during the pregnancy, it can actually make the symptoms worse after pregnancy. Could you speak a little bit to that, prescribing medication, the safety of the medications that we have? I'm very comfortable prescribing Zoloft for my patients. So I don't know if you have a favorite one that you go to that works great. And so I just wanted you to speak a little bit about medication in pregnancy and afterwards.
Yes, 100%. So like most things in medicine, right? It's a case by
Right.
case evaluation where we weigh the pros and the cons of something. So in this case, let's take depression as an example. It's always important to consider if someone were to be depressed, if the risk of acute depression, if it were to relapse or occur during the pregnancy, may outweigh the risk of taking antidepressants. I think that's the first consideration. The second consideration is medication. There are a lot of options out there. So, for instance, there's medication that is quote unquote safer, meaning research shows, official research shows that it's not associated or less likely to cause any effects in the baby, whether during pregnancy or if someone chooses to breastfeed down the road in lactation. So there's always that option. And then the third thing, which I think is really important, especially for moms, your peace of mind, especially in this turbulent state, right? Pregnancy, postpartum, new baby, toddler. There's so many ups and downs, so many unknowns, so many things out of our control. So your peace of mind is perhaps one of the most important thing that we need to take care of. So if you're having any doubt, if you're suffering, but is still hesitant in terms of medication versus non-medication option, perhaps it's best to seek out professional help. If you want to connect with your local perinatal psychiatrist to just talk through the options, understanding the pros, the cons, what to expect, what not to expect with each option, including different types of medications if indicated, it would be the best way to go.
And so the first one is that your peace of mind is important. It's how you can be your best self in caring for your new baby. And people always worry about, will this medication be safe and things like that. And we, after proper counseling, you can determine if that's the right medication for that baby. And we can tell the pediatricians also after the baby's born that mom was taking this medication during pregnancy so they can better care for the baby as well. But I also agree that managing your symptoms and treating your symptoms, it's what is going to make you capable of managing a new baby. And so not being afraid, if the psychiatrist is recommending medication, not being afraid to take it, because your peace of mind is what's going to make you the most available mom that you can be through that very stressful period of time. Would you say that's accurate?
Very accurate. And also I'd like to add, it could be very, very hard to quote unquote think objectively when for example, when we're feeling depressed, when we're feeling anxious, when we're feeling overwhelmed with all these new life changes. But it's always important to consider what a depression or depressive state or an anxiety state could do, not just to you, to the moms out there who are listening, but also to the baby, right? We cannot pour from an empty cup. And, if we're depressed as moms, it'll be super hard to bond, to make sure that the attachment is there with the new baby, to take care of the baby, physically, emotionally, mentally. So the ramification, if for untreated challenges such as this one, could be very significant in that regards as well.
Well, that's a great point. That it's not just about those symptoms, if not addressed, if not treated, if not managed, will affect your ability to bond with your baby, be able to provide the emotional attachment that, so your baby will notice, basically, right?
Yeah.
So being, number one, allowing yourself to feel these emotions. Number two, practicing some self-care, and it doesn't have to be elaborate. It could just be, like you said, taking in deep breaths to identify what you're feeling, doing a little bit of physical activity to get blood flow to your brain and change up your perspective on the situation. And seeing someone, asking for help, and not being afraid to ask for help. And if that person recommends medication, not being afraid to take the medication, having a thorough conversation about what's safe, talking to your OBGYN about starting medication, talking to the pediatricians that you're taking this medication so they can help you, take care of your baby when your baby's born, because your peace of mind and your stress level and all those things will transfer to your baby. So if you're at peace, it'll transfer to your baby. If you're overstressed and depressed and anxious, it'll transfer to your baby. So being intentional about being at your best place so you can be the good enough mom that you can be for your baby. Does that make sense?
100%.
Awesome. Those were all my questions. Anything else that you would like to share with us before we go?
Yes. So I just want to say to all the moms and perhaps moms to be out there, I hear you. I see you. It could be a very, very stressful time. And it's very, very easy to feel alone, feel like there's no light at the end of the tunnel, that we're trapped, that help is just too far away. But I'd like you to know that it's not true. You're worth it. Your mental health is worth it. Your well-being is worth it. And help is just one call, one email, one click away. If you're in California and you don't have any local psychiatrists and feel like you need extra help, feel free to contact me at my website, lifestyletelepsychiatry.com. If you're not in California, I still do offer free additional resources for this at my website, lifestyletelepsychiatry.com/subscribe. Or either way, please feel free to get in touch on Instagram at the same handle, Lifestyle Telepsychiatry.
Yeah, I just posted it in the comments, lifestyletelepsychiatry.com. And thank you for having stuff that's available for people who are not in California, so that even if they can't reach you, they can still have access to some resources through your website. And I think I would recommend that patients ask their OBGYNs, do you know a psychiatrist that I can see? Do you know a therapist that I can see? Sometimes OBGYNs are just like, oh, postpartum blues, come back in 2 weeks if I'm not speaking for everybody. I shouldn't say that. I'm just saying that they should know what they're feeling. My biggest thing is women advocating for themselves, women being knowledgeable about their health, which is why I started the Uncommon Knowledge thing, because I just want people to know that these things are real, these things are true. It's okay. And if you do know and you're not getting that offer from your doctor, then ask. Ask your doctor, do you know a therapist? Do you know someone who specializes in perinatal or postpartum psychiatry that I can talk to? And knowing that you have access, there is access to help for you. And do you have a YouTube channel or any platforms that podcast, anything that we can go watch, anything that you have available?
Not currently, but I do list it.
Mom of two under two. I understand.
Right. But if you're all interested, I do list all my guest appearances, media appearances on my website too.
Oh, perfect. So we can go watch other talks that you've had with other doctors and learn more from there.
Yes.
Oh, perfect. Perfect. Thank you so much, Dr. Sarah. I really appreciate that. This was enlightening. I'm really grateful that we had this discussion.
Of course, pleasure is all mine. And also, Dr. Durwade, I wanted to add for all of you who are in Illinois in the area, please check out Dr. Taiwu's practice for all your OB care needs to make sure that you're getting the best care out there.
Oh, thank you. I appreciate that. Have a wonderful rest of your day. Thank you so much, Dr. Sarah Pospos.
Thank you so much. You do as well.
All
Have a
right.
good one. Bye, everyone.
Bye bye, everyone.